Hello, my name is Robert Giuliano, and I'm editor-in-chief of the new Anticoagulation Management Clinical Community available on CardioSource. Today, I'm talking with Professor Ramon Corbalan from Santiago, Chile, on the topic of novel anticoagulants. Welcome, Professor Corbalan. Could you tell us a little bit about the status of oral anticoagulation in Chile for our audience?
Well, here in Chile, we use mostly vitamin K antagonists, and it is interesting that we are utilizing more acinocumarol instead of warfarin for historical reasons, because for some time warfarin was not available. So the proportion of use of these anticoagulants is about 80% acinocumarol and 20% warfarin. And these have been utilized, and most of our patients are controlled in ambulatory clinics for determinations of INR and regular dosage of the medications. What we have learned is that our TTRs are not as good as those reported by European centers. In Europe, some years back, they reported a 60% success in TTR, whereas in our centers, particularly at my center, where we performed an analysis during last year, we were running between 43 to 44% of adequate TTR. We also analyzed this problem in valvular patients, and it was interesting to see that the TTRs were better better obtained with warfarin compared to acinocumarol, although the adverse events were similar with both drugs. In the CHATS scores or CHATS-VAS scores of our patients are very similar to what is being reported in the literature. Most patients are between CHATS-VAS 2 and 4, and the utilization of anticoagulants is mostly for atrial fibrillation, also valvular patients, pulmonary thromboembolism, prophylaxis, etc., the regular ones. But we have a large population with atrial fibrillation under control.
Very good. Could you share with us, Professor Corbalan, a few thoughts about the novel oral anticoagulants, what their benefits are, what you may see as challenges?
Well, the major benefits of these new anticoagulants is that they do not need INR control. That is very complex to perform it regularly for many patients. And the fluctuations of INR due to the different factors that influence vitamin K antagonists are not present with these new oral anticoagulants. So I think they have major advantages. I think they will be utilized more and more, although the introduction will be somewhat slow, because it needs a cultural change among patients and among the doctors. All doctors are familiar with the INR, and all patients are also familiar with the INR, and they're usually concerned when the INR goes down or up. The same occurs for the doctors, that they want to measure something. But once this is overcome by patients and doctors, I think the utilization of these new novel anticoagulants will be progressively expanded. And it's good that we now have approval for not only for atrial fibrillation but also pulmonary embolism. That is also a major advantage. So the medical community is turning slowly but progressively to these new agents. Another factor that could be against the widespread use of these drugs is the cost of these new compounds. I'm hoping that with some pharmacoeconomic studies that we are performing and with the introduction of all new compounds, the four of them, I mean dabigatran, rivaroxaban, apixaban, and edoxaban, maybe the cost will be reduced. But that is a major disadvantage for the utilization of these drugs in the public system, for example.
Thank you so much, Professor Corbalán, for sharing your insights regarding the novel anticoagulants. I would encourage you and the audience to visit the community frequently for ongoing information about anticoagulation management. This is Robert Giuliano for the CardioSource Clinical Community on Anticoagulation Management.